Safety and health information of chemical chlorine, Cl2. Chlorine gas is heavier than air. Its solution in water is a strong acid. It reacts violently with bases and is corrosive. The substance is a strong oxidant. Reacts violently with combustible substances and reducing agents. The substance reacts with most organic and inorganic compound, causing fire and explosion hazard. It attacks metals, some forms of plastic, rubber and coatings. Chlorine is not combustible but enhances combustion of other substances. Many reactions may cause fire or explosion. In case of fire, keep cylinder cool by spraying with water. There should be no direct contact with water. If exposed through inhalation, it may result to cough, sore throat, shortness of breath and wheezing, labored breathing. Symptoms may be delayed. For liquefied chlorine gas, if in contact with skin, may result to frostbite, redness, burning sensation, pain and skin burns. May cause watering of eyes, redness, pain and burns if in contact with the eyes. According to UNGHS criteria, it may cause or intensify fire as oxidizer. The gas under pressure may explode if heated, fatal if inhaled, causes severe skin and eye damage, may cause respiratory irritation, may cause damage to lungs through prolonged or repeated exposure, and very toxic to aquatic life. For first aid measures, if inhaled, provide fresh air and rest. Half upright position, artificial respiration may be needed and refer immediately for medical attention. If in contact with skin, rinse with plenty of water for at least 15 minutes, then remove contaminated clothes and rinse again. If in contact with the eyes, rinse with plenty of water for several minutes and refer immediately for medical assistance. In case of spillage, evacuate danger area. Consult an expert. Use personal protection such as gas-tight chemical protection suit including self-contained breathing apparatus. Ventilate the area and shut off cylinder if possible. Never direct water jet on liquid. Remove gas with fine water spray. For occupational exposure limits, the threshold limit value of chlorine is 0.1 ppm as time-weighted average and 0.4 ppm as short-term exposure limit. For the exposure prevention, provide adequate and appropriate ventilation, eyes breathing protection, cold insulating gloves and protective clothing, wear face shield or eye protection. Additional notes: the symptoms of lung edema often do not become manifest until a few hours have passed and they are aggravated by physical effort. Rest and medical observation are therefore essential. Immediate administration of inappropriate inhalation therapy by a doctor or by authorized person should be considered. The odor warning when the exposure limit value is exceeded is insufficient. Do not use in the vicinity of a fire or a hot surface or during welding. Do not spray water on a leaking cylinder and turn leaking cylinder with the leak up to prevent escape of gas in liquid state. Always remember that it is serious bile routes of exposure. That's it for chlorine. This is Engineer Ellen, and keep safe everyone.